big news which came in late last night that the Union Cabinet has approved health coverage for all citizens above the age of 70 years, irrespective of their income status, under the Ayushman Bharat PM Jan Arogya Yojana. Now, this move aims to benefit approximately 6 crore senior citizens from 4.5 crore families with a 5 lakh free health insurance cover on a family basis. The eligible senior citizens under the scheme would receive a new district card which entitles them to benefits of the scheme. Additionally, senior citizens aged above 70 who are already covered under the Ayushman Bharat PM Jan Arogya Yojana will get an additional top-up cover of rupees 5 lakh per year. Meanwhile, those senior citizens who are already covered under other public health insurance schemes such as CGHS, ECHS or Ayushman CAPF can opt to either continue with the existing scheme or switch to Ayushman Bharat PM Jan Arogya Yojana. So this is, of course, the decision which is being lauded, but what does it really mean for you, our dear viewers? Let's just put that across to my guest joining me. We have Ashish Jhambh, Director and CEO of Infinia Insurance Broking, and Dr. Rahul Pandit, Chair Intensive Care Unit of the Reliance Foundation Hospital here. Let me go across to Ashish Jhambh, you first. Ashish, in a country where getting health insurance for senior citizens, private health insurance for senior citizens above the age of 60 is becoming increasingly difficult because of the general tendency or the general risk factors, this will come across as a boon for all citizens because this is irrespective of a citizen's income.
Yeah, you're absolutely correct, because that has been the need of the hour. If you see post-COVID, and COVID has taught us that the rising cost of medical treatment is so high, and this is, I think, a fabulous move by the government, and is extremely going to be well appreciated by the the general people who are. It's the need of the hour, and I think it's an extremely welcome move. And the government has taken care of the fact that there is the scheme is without any irrespective of income levels. That's something which is extremely welcome.
Yeah, and does this also help in increasing the sense of insurance literacy in the country, in a country which people often don't understand the concept or on the importance of something as vital as health insurance?
Yes, see, what happens, the penetration of insurance in India is extremely low. This kind of a push will start educating people into taking the benefits of insurance and seeing that how they can get care in very good hospitals. And, because of denial of financial need, people's treatment should not be denied. So it's, I think, a fabulous decision.
Absolutely. Okay. Dr. Rahul Pandit, what is your take on it? How does the private sector respond to what many people, such as Ashish, is calling a game-changing announcement?
Well, I'm a clinician. I might be working in a private sector hospital or a foundation hospital, but as a clinician, I must congratulate the Ayushman Bharat scheme to actually cover the people above 70 years of age, irrespective of their social status, and congratulate the government of India on that. And I would say that really, COVID has actually taught us that unified or uniform health scheme for everybody is very, very important. And this is the category of patients above 70 who actually need the most. And also they are the ones who have financially the biggest problems or the challenges, because obviously they are into the retirement age at that time. So I see this as a very welcome move. I see this as a forward step towards having uniform health for everybody or uniform insurance for everybody. And I think this step was very, very important step. It will go a long way into us formulating the policies for insurance as well as for having uniform health for everybody in the country. I think it's a very important step which the government has taken.
Dr. Pandit, if I could be the devil's advocate, and I also put that question across to Ashish as well, but first to you, Dr. Pandit, the only alternative criticism, or at least the only alternative viewpoint coming in, is that by opening this scheme out to patients or senior citizens across all income groups, you are putting an unnecessary burden, because ultimately this will be funded by the taxpayer, by giving free insurance cover to people perhaps from economic groups who can afford healthcare, especially even if they're above the age of 70. Do you necessarily agree with that sentiment, Dr. Pandit?
I don't agree with that sentiment because it is healthcare. I understand that there is nothing should be free because then it loses its value and its importance. I understand that concept and I understand the financial burden as well. But when you're talking about health, it is the basic right of every citizen. Health is not something which we are talking about as a privilege. Health is something which is a necessity, which is your basic right. And for that, if the government is implementing these schemes, I think it is very important to support them and look into the right spirit in which the government is doing it.
Okay. Ashish, would you like to weigh in on that? Especially, I also wanted to understand if, for the benefit of the viewers who are watching this broadcast, how does this now matter to them in terms of what are the steps they have to do, especially for those who or perhaps already have cover of Ayushman Bharat Yojana or other private insurance or state insurances as well. How do they go about to try and ensure they get the maximum benefit from the scheme?
Scheme. It will be, of course, first it's been
Ashish, I think
announced.
we have,
All the
yeah, go on.
all the details will be, rolled out as over a period of time. Senior citizens, I mean, will have a choice. Okay, as far as the other prevailing government schemes are concerned, whether they would like to take benefits of that or avail themselves under this. Okay, so that's one choice that is being given, which is very good. People already who have Ayushman Bharat are usually have been people of the below poverty line, etc. So if they are getting another 5 lakh as a top up, I think it's a great advantage, because the cost of medical treatment is going up constantly, and they are the people who do not have the funds. And today, complicated ailments do cost a lot of money. So that's point one. Third thing is, as far as you see, even a local policyholder, if you see any other, when you spoke about people who are privileged and they have health insurance, but every senior citizen who has health insurance also today has a cost which is very high on premium. But here, if something which is coming as a benefit from the government, the larger interest of the population is very high. There are very, very few senior citizens who can afford it on their own. So I think it's an extremely welcome thing, and the nitty-gritties will be, of course, there will be an enrollment process, there will be a method, there will be, entire details which will be rolled out. And I think over time, this will become well executed, which I'm quite sure it will be, because we are seeing the present Ayushman is Bharat is doing very well, and it will become one of the best schemes in the world in times to come.
Absolutely. Dr. Rahul Pandit, my final question. Will the next step now be naturally to lower this age, perhaps to involve citizens above the age of 65 or 60 to ensure that this monumental scheme applies to a wider bracket now?
I think it would be too premature to say that it would actually, yes, it is something which could be seen in the future. I don't see it happening immediately. I think government would like to implement this scheme properly, would like
Okay.
to get the feedback from this. And that could take over several months to a few years before they even start thinking about rolling it down to a age group which would be younger. But it's true that while India is a young country, we also have an aging population which needs this help, which needs this financial support. And I believe that the government would take the right directions in lowering this age whenever they feel it's appropriate. And at the same time, of course, the financial situation of the country also would be taken into account when they actually start to lower it, because you will be adding more and more people to the whole benefit of the scheme. So I think all these things would need to be taken into consideration only
Yeah.
after a few years. I don't see it happening immediately.
All right. All right. Thank you so much, Dr. Rahul Pandit, and also Ashish Jhambh for joining us on this short but insightful discussion. We will also focus on this in prime time as well. But thank you so much, gentlemen, for joining me on Mirror Now today.